So we will start with what is selective mutism? It is considered a childhood anxiety disorder where the child is unable to speak or communicate, and this is due to feeling anxious. This doesn't mean that the child cannot speak. There's certain scenarios where they do, such as at home, where they're comfortable, but they won't at school. There For causes, there's not a single cause for selective mutism, but there are several factors that can coexist. Typically, they're associated with anxiety disorders. It can be social phobia, separation anxiety, and OCD. Environmental factors can come into play. Some of these things are social interactions, observing anxious behavior, and reinforcement of avoidant behaviors. And sometimes there are genetic components that overlap. Now, moving on to characteristics. This affects 1 to 2% of the population, and typically it affects more females than males. And there is more prevalence among immigrant and language minority children in comparison to non-immigrant children. Some characteristics are listed here, such as lack of eye contact. They may cling to parents, can be found hiding often, can run away, cry, freeze up, or have a tantrum when they're being asked to speak in public. Usually, children with selective mutism avoid eating in public settings, are anxious when they need to have their picture taken, or may be anxious to use public restrooms. Their language profiles are very interesting. Typically, individuals with selective mutism do have the ability to speak, but as previously stated, they won't speak in social situations. This can have a very negative effect on their academics, in their educational settings, or in social performances. For example, if a child is asked to give a presentation in front of their classmates, that might not be something that they're capable of doing in a school setting, so they might need an accommodation for that. There are several assessment procedures. One of them is conducting a diagnostic interview with the parents, the caregivers, and the teacher before meeting formally. This is important before meeting the child because the parent or caregiver can give us good information that we need in order to effectively do a formal assessment. And that's because we might not have the child speak to us because we are an unfamiliar as well. So that is helpful so that we don't have any expectations for the child to speak. We don't want to trigger the child anymore since this is a disorder that is prevalent with a child who's already anxious. We might let the child play while we wait so they can warm up, and then the speech language pathologist can enter a room. Another thing that can be done to help us in our assessment for a child with selective mutism is observation through recording. We can have a family member record the video when the child is talking in a comfortable setting, and we can make an assessment based on that. We can also assess nonverbal communication using augmentative and alternative modes of communication, such as gestures, finger spelling, or picture communication boards, depending on what child can or can't do. Now, I'm going to pass it along to Daniela to review some intervention strategies.
So when we were looking at intervention strategies for children with selective mutism, we looked at it from a cognitive and behavioral standpoint, and we also want to collaborate with school psychologists and teachers in implementing these approaches. So the first one is the ritual sound approach. And in this approach, it is a cognitive and behavioral-based treatment, and it is part of a social communication anxiety treatment. So the RSA teaches sound production from a mechanical perspective. So they use shaping to reinforce oral movements, and the sounds progress from the phoneme level to syllables and then to words. We don't want to pressure the child to specifically start speaking words. The steps that the SLP can use to do this is talking to the child about non-speech sounds and how we move our mouth and how we breathe and blow and relate them to coughing sounds as well. The SLP then describes the voiceless phonemes and how they are produced using those actions such as breathing, blowing, and coughing. The child is then encouraged to produce the voiceless phonemes. The next step would be then to use the alphabet board where the child can cross off sounds that they can already produce. And it's going to be a distraction from having to make eye contact with the therapist, which will help reduce the overall anxiety during intervention. The SLP will then explain how these sounds are blended into words and then eventually get the child to start producing those words by blending the sounds. Next approach is social pragmatic approach. And in this approach, we are focusing on the child's participation and social engagement, whether that's verbally or nonverbal. Again, we don't want to pressure the child to be speaking in all of these intervention approaches because it can trigger feelings of anxiety. So with this approach, it does increase in difficulty over time, and shaping and reinforcement interaction routines are used to move the child up the ladder. And this ladder starts with what the child just accepting to be part of joint activities, games, art, social play. So we slowly introduce them to all of these activities. Then we use nonverbal communication during joint activities, such as gesturing, pointing, and reaching. Again, we are slowly engaging the child in settings where they feel a little more anxious. Next, we will move up the child through a hierarchy of production of sounds and speech sounds. So that is kind of related to the ritual sound approach. So we will then focus on them using those sounds in those social settings and social interactions, and then eventually building up to the word level. Lastly, we have augmentative self-modeling. And in this approach, the child observes themselves engaged in adaptive behavior. This is behavior that we want them to be able to eventually do in settings where they are not feeling too comfortable. It's a virtual glimpse for the child, and it can be done in two ways. So the first way is where a child watches a video of a verbal interaction where the child is engaging in a positive verbal interaction with people who they are comfortable with. This is then edited and places the child in a setting where they are not as comfortable, for example, a school. So then the child will learn to use these communication skills in an environment that's a little bit more challenging for them. The next approach is the other way is where the child listens to an audio recording of their speech in adaptive situations. And they review this audio recording repeatedly in order to be able to develop those skills for positive interaction. When we are collaborating, we collaborate with classroom teacher and school psychologists. Those are two of the many that we would collaborate with children with selective mutism. The teacher's role in working with these children is helping them develop a supportive relationship and interactions, even if those interactions are nonverbal. The SLP and teacher will work collaboratively to support the child's learning in the classroom. Ways that this can be done is providing the child with a classroom partner to help reduce their anxiety. Another one would be then introducing them to a small group instruction and activities and encouraging participation without pressuring them to speak again. And then lastly, arranging one-on-one time with the teacher in order for that child to seek assistance independently instead of in front of their peers.
School psychologists are also involved, and they are a very important part of the interprofessional collaboration team. They start being involved at the assessment component, then treatment planning and implementation, given that selective mutism is an anxiety disorder. Psychologists can render intervention strategies and can teach the SLP those strategies so that we can use them in our own speech interventions to be more effective in general.
Okay. Here we have listed some website and book resources that are beneficial for people wanting to learn more on selective mutism. So 2 websites include Selective Mutism Association and Child Mind Institute. And in these websites, you can find them for further information on selective mutism, but also based on your state, you can find community groups and resources within your state that can provide parents with guides and support groups for them. We have also listed 2 books. One is Selective Mutism, a guide for therapists, educators, and parents, and Overcoming Selective Mutism, the Parents Field Guide. These are also just great resources for wanting to learn more about how to work with children with selective mutism.